Blood disorders. Blood disorders, also known as hematologic disorders, are conditions that affect the components of blood, including red blood cells, white blood cells, platelets, and plasma. These disorders can arise from genetic mutations, acquired factors, or a combination of both. Here are some common types of blood disorders. Anemia. Anemia occurs when there is a decrease in the number of red blood cells or a decrease in the amount of hemoglobin in the blood. Hemoglobin is responsible for carrying oxygen to the body's tissues. Anemia can result from various causes, including nutritional deficiencies, iron, vitamin B12, folic acid, chronic diseases, bone marrow disorders, or hereditary conditions like sickle cell anemia and thalassemia. Hemophilia. Hemophilia is a genetic disorder that impairs the blood's ability to clot properly. This can lead to prolonged bleeding after injuries or spontaneous bleeding into joints and muscles. Hemophilia is usually caused by a deficiency of certain clotting factors, such as factor VIII, hemophilia A, or factor X, hemophilia B. Leukemia. Leukemia is a type of cancer that affects the bone marrow and blood-forming cells. It leads to the overproduction of abnormal white blood cells, which can crowd out normal cells and impair their functions. Leukemia is classified into different types based on the specific type of white blood cell affected. Acute lymphoblastic leukemia, ALL, acute myeloid leukemia, AML, chronic lymphocytic leukemia, CLE, and chronic myeloid leukemia, CML. Lymphoma. Lymphomas are cancers that originate in the lymphatic system, which is a part of the immune system. There are two main types of lymphomas, Hodgkin lymphoma and non-Hodgkin lymphoma. These cancers involve the abnormal growth of lymphocytes, a type of white blood cell, and can occur in lymph nodes, spleen, bone marrow, and other lymphatic tissues. Thrombocytopenia. Thrombocytopenia is a condition characterized by a low platelet count in the blood. Platelets are essential for blood clotting, and a low platelet count can result in an increased risk of bleeding and bruising. Thrombocytopenia can be caused by various factors, including bone marrow disorders, autoimmune conditions, and certain medications. Myelodysplastic syndromes, MDS. MDS are a group of disorders in which the bone marrow does not produce enough healthy blood cells. This can lead to anemia, infections, and bleeding problems. MDS can sometimes progress to acute myeloid leukemia. Polycythemia vera. This is a rare blood disorder characterized by the overproduction of red blood cells in the bone marrow. This can lead to an increase in blood viscosity and an increased risk of blood clots. Sickle cell disease. Sickle cell disease is a genetic disorder that affects hemoglobin, causing red blood cells to become misshapen and break down more easily. This can lead to anemia, pain, organ damage, and other complications. Thalassemia. Thalassemia is a group of inherited blood disorders that affect the production of hemoglobin. People with thalassemia may have mild to severe anemia and require regular blood transfusions.
Like, share, subscribe. Thanks for watching.